taking the opportunity to talk about why our mental health is so important, and going further, why access to support and resources are so important. Health reporter Haley Hernandez is joining us now. With that, Haley, good morning.
Hey, good morning, Andy. So joining me this morning is Lisa Wright, President and CEO of Houston-based Community Health Choice. Now, here's why it's important for communities and workplaces to advocate for mental health and provide support. Good morning, Mrs. Wright. So tell us, like I mentioned, just why you think that it's important for the community to rally and be supportive of mental health.
Mental health is so important. It's just as important as physical health. And so when you think about taking care of yourself, not only do you get checked for your physical health, but your vision and your dental, you should also do a checkup on your mental health.
So to explain to people who might not be familiar with Community Health Choice, you offer affordable and basically low to no cost health insurance plans, and a lot of insurance plans do not cover therapy. So is that something that your plans can help provide?
Absolutely. So as you said, we are a health insurance company. Our goal is to provide the top quality care. We not only believe in physical health, but parity. So parity with mental health. And so essentially what that means, everything that you would expect to get from the physical side, we make certain that you are also getting that on the behavioral health side.
Interesting. What would you say to employers, because sometimes that's the piece of the puzzle that's needed in order to get insurance companies to cover mental health? What would you say to employers? How do you get them on your side to cover this?
It's really about having a healthy workplace. You want to have a healthy workplace. When people show up at their best, being part of your best is not just your physical health, it's also your mental health. And we think about things about how do you eat better? How do you have exercise? How do you make sure employees are getting sleep? And so doing things like providing gyms, providing cafeterias that offer healthy options, and also looking at work-life balance. You know, as a leader, how you lead is how other people lead. And so what we want to make certain that we do is provide that outlet to all of our employees.
I actually just hosted a luncheon for the Latina Leadership podcast. And we were talking about this yesterday and talking about ways that we can break down those barriers and talk to our employers about getting this covered. There's still such a big stigma, especially within minority cultures. So what makes you so passionate about this? Where did your interest for this come from?
You know, what I truly believe about mental health is that just like everything else, I mean, if you want to show up your best, you want to look your best, you make sure you go out and you buy nice clothes, you make certain that you're going to the doctor, you want to do a checkup. And there's nothing wrong with doing a checkup. You know, part of mental health is belonging. Part of mental health is relationships. And all of us want to feel like we belong. All of us want to be in a relationship. And so that's why it's important, because being able to connect is very important. And so when we think about overall health care, part of that is getting checked on the mental side.
The mental and physical health really go hand in hand. And a lot of people are going to hear this and say, well, that sounds great, but they still believe it's unaffordable. What are your resources that you can help connect people to mental health care in the area? What are some of the resources that you recommend?
You know, we are fortunate to live in a great state that really focuses on health insurance and focuses on health care. And so there are places like the Harris Center. The Harris Center is probably one of the third largest systems that offer access. And access is a huge problem here in Texas.
Yes.
So access to psychiatrists, access to therapists, access to psychologists. And not only them, you also have Legacy. Legacy is one of the largest federally qualified health centers, and Legacy also offers a wider range of mental health services.
Yeah, they do. They're fabulous. Do you also ever work with NAMI?
Yes.
NAMI can be a great resource for people as well.
Yes.
Yeah. So anything else that you'd like to say, because it is Mental Health Awareness Month? Anything else that you'd want people to know about?
I would just encourage people to get checked. You know, this is the time. There's been so much light shed on mental health as we all lived through the pandemic, and there was such an increase. And so as people had to deal with loneliness and deal with lack of socialization, now is the time to go out and get checked. You know, go for a run. Eat a healthy meal, spend time with family, pick up the phone and call someone.
And getting checked can also mean just going to your primary care provider, because so many of them are valuing integrative health now, where they're combining the mental and the physical health.
Absolutely. You can go to your PCP. Your PCP is going to ask you a series of questions through an assessment to also gauge your mental health. And so you don't have to go to an actual therapist. You can go to your PCP.
Excellent. Well, thank you, Mrs. Lisa Wright, for joining us this morning with Community Health Choice. I appreciate you taking time.